ADHD is caused by a deficiency or lack in two neurotransmitters, norepinephrine and dopamine. These two neurotransmitters are created naturally within the body, but some clients don't create enough. Dopamine and norepinephrine help with cognitive function, so attention, staying on task, focus. With ADHD, we have certain criteria because a lot of days some of us are more hyperactive than others. We may not be as focused or have our head in the clouds. These clients, we will see consistent inattentiveness, lack of focus, and hyperactivity for at least 6 months, as well in multiple environments. So at home, children may be more hyperactive there because they're more comfortable. But if we're also seeing that in the schools, that means we need to look further into it. There is a genetic predisposition to ADHD, so typically we will see clinical features before the age of 12. We also want to make sure this inattentiveness, impulsivity, lack of focus, or hyperactivity is not caused by any outside factors, such as medication or mental disorders. Clients who are being evaluated for ADHD must have functional impairment or disruption within their daily lives of inattention, focus, and lack of cognitive function. Let's go into a little bit more detail in what we'll see with these clients with ADHD. Again, we're noticing inattention, lack of focus, inability to stay on task, or inability to understand or follow instructions. Clients may also be forgetful or lose things frequently. And again, within the name, we're going to see hyperactivity and impulsivity. These children are typically the distractors in the classroom. They may be causing disruptive noises, talking excessively, fidgeting, or be very restless. So let's talk about nursing interventions or ways to care for these clients. There are multiple ways to address ADHD. The first is with any type of behavioral therapy. A lot of clients don't want to initially start with medications, so behavioral therapy can be a first step in helping treat ADHD. Here, clients will receive positive reinforcements if they're able to understand and follow instructions, sit still for a task, or complete a task in its entirety. There are two pharmacological interventions we can use for ADHD, one of them being stimulants. It may seem confusing to give a stimulant to a client with hyperactivity, but all that stimulants do are to help produce more norepinephrine and dopamine. Since stimulants work on both neurotransmitters, they can have more side effects, and not all clients are able to tolerate this. So that's when we consider the second class of medications, SNRIs, or selective norepinephrine reuptake inhibitors. This class of medications helps collect more norepinephrine since the body is not creating enough. These medications tend to have less side effects because they are only working on norepinephrine, so we get to avoid the dopamine side effects. All of these clients should expect to have lifelong treatment as ADHD will not self-resolve. It's important to educate clients how to handle their ADHD in normal everyday life. Creating a structured environment and also an organized, consistent home routine can be very helpful for these clients. Because they are easily distractible, we want to make sure that we're minimizing those distractions when trying to complete a task. So when a child is trying to complete their homework, make sure that the TV's off, the music is off, and no siblings are playing in the background. It's also important that we have a safe environment and try to prevent any type of injuries due to these clients' hyperactivity. Incorporating regular and frequent breaks can also help clients finish their task and not be forced to sit for long periods of time, which can be difficult for them. So we spoke a little bit earlier about possible side effects of medications to implement for clients with ADHD. Let's talk about that a little bit further. A lot of these medications can cause appetite suppression, and therefore we might see some weight loss in these clients. These medications are very important to take with meals, so we want to make sure that we're offering nutritional, dense foods frequently. This medication is typically given in the morning with breakfast. So as the day goes on, these medications start to wear off and appetite can start to increase in the evenings. It's important to offer frequent snacks that are nutritionally dense and also offer larger meals in the evenings as the appetite might have come back by then. These clients are typically on the go and, as we said, hyperactive. So we want to make sure we're offering snacks that they can take with them and don't have to sit down to eat. As we spoke earlier, the medication is given in the morning, and this can help with any possible side effects of insomnia or restlessness at night.